Have you ever wondered how far we've come in the fight against cancer? We've made leaps and bounds in research and treatment, from radiation therapy to cutting-edge immunotherapies. Yet we still face challenges. One of the biggest? Understanding complex heterogeneous tumors. These unpredictable cancers have long puzzled scientists and hindered effective treatments. Traditional two-dimensional models have fallen short in capturing the full picture of these tumors. What if we told you a team of scientists has found a way to better understand these complex cancers? Enter the world of 3D bioprinting, a groundbreaking technique that's revolutionizing cancer research. Now let's dive into the process of creating these remarkable 3D tumor models. Imagine a team of scientists meticulously engineering tiny structures known as polymer microfluidic chips. These are not your average chips. Etched with minuscule channels, they emulate the blood flow and other fluids surrounding a patient's tumor, simulating the tumor's complex environment. Next, the team cultivates multiple types of cancer cells. These cells are then suspended in a specially formulated solution, or bio-ink. This isn't your usual ink. It's a cocktail of gelatin, alginate, and other nutrients, all designed to keep the cell cultures alive and thriving. Now picture a 3D printer. But this isn't your run-of-the-mill 3D printer. This is an extrusion bioprinter, a device that, instead of plastic or metal, layers organic material. The team uses this extraordinary machine to layer the different types of cancer cells onto the prepared microfluidic chips. The resulting masterpiece is a living 3D model of complex cancers. It's like a landscape painting, capturing the intricate details and diverse cell populations of a real tumor. But unlike a painting, this model is alive. It breathes, grows, and responds to treatments just like a tumor inside a patient's body. This results in a living 3D model that more accurately represents complex cancers. It's a game changer, offering a new way to understand and tackle the many faces of cancer. So, how does this 3D model change the game in cancer treatment? Well, imagine having a detailed map of a labyrinth before stepping into it. The three-dimensional tumor models are akin to these maps, providing an intricate layout of complex cancers. This allows scientists to tailor treatments such as chemotherapy to the specific characteristics of the tumor. These models are especially significant for conditions like late-stage breast cancer, where traditional biopsies often fall short. Instead of trying to navigate the labyrinth blindly, medical practitioners can now use 3D models to develop a clearer understanding of the tumor's structure and its surrounding environment. The result? Potentially quicker, cheaper, and less painful treatments. No longer will patients have to endure a trial-and-error approach. Instead, treatments can be more accurately targeted, improving survival outcomes and reducing the physical and emotional toll of the disease. This research opens up new possibilities in the fight against cancer, bringing hope to patients and their families around the world.